Hi, everyone. Thank you so much for joining today. My name is Rachel. I'm the voice behind Mommy Did You Know, which is a great pregnancy and parenting website for those of you who haven't seen it. So I'm just very excited that all of you guys are joining me today. I know we have a few people on. I'm just waiting for a few more. I know we had a bunch sign up for the class. So if we can all start out, I guess we can do a little introduction. My name is Rachel. I am a mom of two. I also am a maternity nurse, so I absolutely love what I do. I work in the hospital, so I've been doing this for a while. I absolutely love it. And so for you guys, 20 weeks from Florida. I'm actually from Florida as well, so we're around the same area. I know that this class has been really helpful to a lot of people. And hopefully you got the PowerPoint on the Eventbrite online page. You should see a little thing that says download PowerPoint, and it'll have the information there. If not, you should see it on the caption, but if not, I can always send it to you. You can always just send me an email, mommydidyouknow@gmail.com, and I can always email it to you if anything. But it has a lot of great information. For the first half of the class, I usually go over pregnancy, labor and delivery. It goes over the different trimesters, different things to think about during your pregnancy. And then we go over childbirth, some pain management techniques, a bunch of different things about that. For the second half is when we go over postpartum care and newborn care. That will be actually the second half of the class will be 2 weeks from now when we go over our next streaming, which you can always sign up on the page. But it's very nice to meet everybody. So to start off, I just want to go over some body changes that you might have in pregnancy. So for a card thrower, I don't know what your name is because that's all that I see right now. But how many, so you said 20 weeks and from Florida. Do you know if you're having a boy or a girl yet? Sometimes they do the ultrasound around 20 weeks. So. And if you do, if not, that's fine. But so for the first trimester, at least you're pretty much over that now, but usually you'll have a little bit of morning sickness, frequent urination, lightheadedness, heartburn, constipation. I'm just going to kind of go over this because I know that, 23 weeks, and then you'll find out. So that's fantastic. And then with everybody, they also sometimes find out in different times. I know some people, they wait until the baby's here, or other people, they do that, the test like really early in their pregnancy. I found out about 20 weeks with ours as well. And then there's different changes, of course, in the second trimester, third trimester. Second trimester, you start getting your kind of wind of extra energy, where the first trimester, you're really tired. You're trying to spend all of your energy on the baby. Second trimester, obviously, your second wind comes back in. You might even get Braxton Hicks, which are those practice contractions, which are actually just your body getting used to delivery, getting ready for delivery. And you might actually feel them a little bit earlier with your second pregnancy than you did in your first. So I see we have a few more people joining. If you can just type in how many weeks you are and where you're from, that would be great, especially for the week, so I can kind of gear where everybody's at so we can focus on everybody specifically. That's one thing I really love about a live class is that, in the end, my focus is you guys. I want to make sure that if you guys have any specific questions, if you guys have any concerns, at least we'll be able to bring it up here, one-on-one, face-to-face, and it's just such a great resource for everybody. Oh, that's fantastic, Seattle. And that's what another thing I love about this is we have people from everywhere. So we have, Seattle, New York, and it seems like everybody's about 20 to 34 weeks. So about getting there, which is perfect. I know that as your pregnancy progresses, you're like, I wish I can see my baby already. It's very exciting. So while we're going over body changes in pregnancy, pretty much everybody should have the PowerPoint. But what are some specific things that you guys are going through? Because then I can give you specific pointers for your situation. I know for me, with my first delivery, I had a lot of of nausea. I had to drink water pretty much and have saltine crackers. I had to be very careful of my diet, stay away from greasy foods. With my second, I actually had nasal congestion all the time, which was kind of interesting. So I don't know if anybody else is dealing with anything specifically that you would like to share. I know that we all deal with different things. New Jersey. Oh, that's fantastic. In 25 weeks. So pretty much most of you guys are on at least progressing through your pregnancy halfway or beyond. So that's fantastic. And then as you progress through, you might even start having some, if we go into the third trimester, tiredness, varicose veins. For varicose veins, those stockings work absolutely amazing. I use them with mine, especially because as a nurse, I'm walking around a lot. So at least with the stockings, it kind of really made me feel more comfortable. Especially, I even had sciatica. I don't know if any of you guys have sciatica, but it pretty much feels like lightning. And as a nurse, especially postpartum nurse, I'm always having to feel what we call a fundus. A fundus is basically where your uterus is after you deliver. So as a nurse, I remember being very, very pregnant, having to feel where my patient's fundus were. And all of a sudden I would get sciatica and it would just be like lightning all the way up and it would hurt so bad. So for me, I had to wear those belly bands. Like the ones that you would get postpartum, you can actually get during pregnancy as well. And they really help. And then your baby week by week, I see a lot of people are halfway and beyond. So about the 20-week ultrasound is when you really start checking out where if you have a boy or a girl, and they also do a special anatomy ultrasound. That is especially what I want to go over right now. In the anatomy ultrasound, they might say that the baby has something called a spot, which is kind of like a bright spot in the heart, or sometimes they might even see it in the kidneys or another part of the body. If they do see that, you don't have to get too worried. You can follow up with your doctor. Usually I'll see it. It is pretty common in the heart where there's a hole in the heart of a fetus. It's called the foraminal valley. I really like biology, so I hope you guys like biology as much as I do. But if you think about it, the plumbing of a baby is different when it comes to how their circulation works rather than when they're outside. So when they're inside of the body, they're not really using their lungs to filter their blood. Instead, they're using their placenta. So because of that, they kind of bypass the lungs. And their blood goes back and forth between their atrium through this little hole called the foraminal valley. There's also different holes in the heart as well, but the biggest one that people talk about is the foraminal valley. When that hole, pretty much when the baby's born, that hole usually closes up. When it doesn't, that's when a baby can have a murmur. When that baby has a light in that fetal ultrasound when they're doing, sometimes that will kind of point to a baby having that future murmur after birth. Now, that's not that big of a deal. Usually it closes on its own within the first 24 hours. I don't know if anybody did have that spot in the heart with anatomy ultrasound or in the kidneys. If they did, what you would expect would be echo after the baby's born. That's when they pretty much take pictures of the heart. They'll also probably do an EKG where they test the electricity of the heart, and you possibly will have a cardiologist just to listen and see if the baby has any murmur. But it's not that big of a deal, so that's why I just wanted to talk about it right now. So I have a question for you guys. So now we have a few people watching. Can anybody tell me when your baby is considered early term? So you can look at the PowerPoint. It's on slide 7 if you guys are following the PowerPoint with me. But how many weeks is your baby considered early term or term? So that if you were to go into labor, they won't say, oh no, she's going into preterm labor. And you can just type in, if you know. If you don't, that is okay. And there's no right or wrong answers. I know some people are nervous, but I'm not a mean teacher, I promise you. But the answer is your baby's early term around 37 weeks. So after 37 weeks is basically when we're starting to say, okay, our baby is ready for birth. 37 weeks is considered early term, and 39 weeks is considered full term. The difference is if usually most hospitals, if you were to go into premature labor before 35 weeks, they normally would directly admit you to the NICU. If your baby's between 35 and 37, they'll be watching you, just kind of see how the baby's doing, if the baby's breathing well and the baby's eating well. If the baby's doing both of those things well, and then the baby will be able to continue being with you. If the baby's between 37 and 39, which is early term, usually the babies are okay. They just have to work a little bit harder to feed effectively, or sometimes they might need a little bit more time to transition. So in that case, make sure you're doing plenty of skin to skin, working with your baby. Just be patient. We just got to work with our baby either way. Then if you look on slide 8, we start talking about our typical prenatal schedule. So pretty much in the beginning, we're going over our initial blood work, our initial labs. And who can tell me some labs that they've drawn? I know that a lot of people, they kind of go into their prenatal visits and they just give out their arm and they're like, all right, do your thing. But it's so important to know what labs they're drawing. So you can just type in there. And by the way, I am doing a giveaway in the end of this class, but only people that have been active during the class will be eligible for the giveaway. It's kind of like participation, back when you were in middle school or high school, because I want to honor participation, and that is how we learn. Because we're not going to learn just by watching, but we have to learn by participating and being active. So for our next question is, what different labs did they do when you went to your prenatal visits? So I know that they've probably done some blood work on you, and it's very important to know what they've been doing, not only here, take my arm. I'll give you guys a minute. It's very important to drink water as well. So our answer is, and can everybody get to the comment section just in case, but our answer is we have a few different lab tests. We have like our rubella test, which is very important. If you are not immune for rubella, you'll probably get your MMR vaccine after your delivery. We also have our HIV test as well. If you were to have a past HIV infection, that's not that big of a deal right now. What we would do to be expected is your baby probably will be bathed after their delivery, and they'll probably also do special medicines for the baby. They'll also do stuff like hepatitis B. They'll do your CBC as well. Your CBC is your complete blood count, and your complete blood count goes over like your hemoglobin, your iron levels, just to make sure what your baseline is before you go into the delivery. Because let's say your baseline is, and a normal that I'll see during pregnancy is around 11. Sometimes it's a lot higher, sometimes it's a little lower. But let's say your baseline's like 7 and you're going into the delivery. Obviously, you might have to take something like iron, or they might even, if you're going into surgery like a C-section, sometimes they might even have to give you blood or something, if that is, of course, goes on with your belief systems, because I know that some people don't prefer not to have blood, but that all depends on you as well. And you have a right to know what they're doing, what interventions, and you always have a right to be an active member of your care, of course. And then another thing is your nuchal translucency that they actually probably did in the beginning of your pregnancy. And your nuchal translucency is a big indicator of genetic disorders. So if the nuchal translucency basically is they're looking in the neck and they're seeing if there's fluid inside the baby's neck. And then if there's fluid, sometimes that can be a genetic marker to say that the baby might have Down syndrome or something like that. So that's what we're looking at with that. Then we did go over the fetal anatomy screen. And then as you get further and further during your pregnancy, they'll also probably even do GBS cultures. GBS cultures are usually done about 36 weeks. If your GBS is positive, what you would probably expect with that is that you will have some antibiotics before you deliver, just to make sure that if you were to go into labor, that at least the baby's covered. GBS basically is a naturally occurring bacteria that pretty much a lot of women have in their vaginal area. However, if that bacteria were to get to the baby during labor, it can actually be harmful to the baby. So that's why if the GBS status was positive, which does happen, then they would want to make sure that the baby's okay, and we would follow up with your antibiotics just to help with that. If you did not have enough time to have all the antibiotic treatments that you needed, what we might have to do is something called an infection workup on the baby. So that's just something else to look into, something else that they might have to do depending on that. And then if you guys do have any questions during the class, you can always type it in as well. I know that there's a lot that we have to talk about, being that there's so much that you have to learn when you're pregnant, and you just take it step by step, one step at a time. So next stop, I just want to talk a little bit about our pregnancy complications. So there are a few things that can obviously complicate a pregnancy, and the two big ones that I want to talk about are gestational diabetes and preeclampsia. Gestational diabetes is pretty much high blood sugar that is during your pregnancy. Now, you can be diabetic during your pregnancy, have the baby, and then not be diabetic after. So do I have any gestational diabetics? If you do, you can put on there, or if you have any questions. But usually gestational diabetes is able to be controlled by diet. And usually they'll try to have low carbs, low sugars. Keep in mind that carbs do change into sugar. So if you were to be gestational diabetic, make sure that you're cutting down your carbs, you're cutting down your sugar, and you're drinking lots and lots of water. You can also be controlled by injections. They do have injections, which are obviously the insulin, and then they also have pills. If you were to be a gestational diabetic, one thing to think about is that when the baby's born, sometimes they might have to do sugars on the baby just to make sure that the baby's okay, because what happens is the placenta is giving all those sugars to the baby. Then all of a sudden, when the baby's gone, when the baby's out of your belly, all of a sudden the baby does not have that massive storage of sugars from the placenta. So sometimes the sugar starts to drop. So that's one thing just to kind of think about as well. Make sure that you have frequent, effective feedings, and that of course you just stay on top of that as well. And I just realized my chat was not working. So that's why I wasn't seeing when everybody was talking. Well, thank you so much for actually responding. And I apologize for the technical issue on my behalf. But either way, glucose screening, blood test for genetic testing, and you might even see that you will test abnormal and then even normal later during your pregnancy as well. So that's another thing to think about. But normally during your pregnancy, you'll probably be treated with diet and exercise. And then after, you might have a few sugars for you, a few sugars for your baby, and then you should start feeling much better. Skin to skin will definitely help you a lot with that. So just keep that in mind. When the baby's born, try to have as much skin to skin as possible. And try to breastfeed. If breastfeeding is your choice, it's your decision of your feeding planning, make sure to try to breastfeed as soon as you can so that you can be kind of giving those frequent, effective feedings as soon as possible. And then if bottle is your choice, usually for the first day or so, babies have about 10 to 15 cc's of a formula or express milk, whatever your feeding choice is with that. So because their bellies are super, super small. So that's another thing to think about. And then another one that is a complication that some people go through is preeclampsia. So we are on, for those of you who are just joining, is slide number 10 from the PowerPoint. So preeclampsia is high blood pressure. So one thing to think about with that, you'll probably have headaches, blurred vision, and sometimes even your reflexes will be a little off as well. And the thing with preeclampsia that you have to think about is that it's kind of silent when it comes to the symptoms, because sometimes your symptoms won't really show up until kind of further into your blood pressure going up. Because sometimes I have a patient and I'm taking their blood pressure and their blood pressure is like 160 over 110. I'm like, oh my goodness, how's your blood pressure this high? How are you feeling? And she's just sitting there like, oh yeah, I'm perfectly fine. So it really depends on the person. Some people would be completely asymptomatic. But one thing to think about with the blood pressure is that as your placenta is constricting, it is stopping blood flow to the baby. So as your blood pressure goes up, sometimes it might affect even your baby's oxygenation and your baby's growth. So what week would you be diagnosed with preeclampsia? It really can be any time during your pregnancy. So some people, they will go in for their first screening and then they find out that their blood pressure is high. Others, it really doesn't develop into the third trimester. Usually preeclampsia does develop later on into the pregnancy. The biggest reason being of the increased fluid, of course, because if you're thinking about it, all of that fluid is in your circulation. So as that fluid increases, it's increasing the demand on your blood vessels, your heart, and your body as a whole. Usually your preeclampsia would get a lot better after you deliver. And then I'm not sure if anybody, so I have a few different people who have polygestational diabetes, things like that. Do I have anybody that has preeclampsia, gestational diabetes, or any other pregnancy complications that you wanted to talk about? I know that Jacqueline was asking about preeclampsia, which is very, very common. But the biggest thing with preeclampsia, sometimes the babies will be a little bit on the smaller side, and then sometimes you might even have an earlier delivery as well. So let's say you're normally you will be either induced or scheduled for a section around 39 weeks. But if you were to be diagnosed with preeclampsia, it can be a lot sooner than that, depending on how high your blood pressure is. Usually I'll see around 37 weeks when someone has preeclampsia. So we have a few questions here about pregnancy, vasa previa. So a thing with previa, especially with well, the biggest thing that I see is placenta previa, which is basically where the placenta is covering that opening of the cervix. So vasa previa is kind of a similar thing, but I don't see that as often. The biggest thing that I see is placenta previa, or I see that the baby is breech position, where is when the baby's kind of butt first or feet first. And the thing with that is the baby does either, if the baby is feet first, the baby does have to kind of swing around so that the baby can be head first to have a vaginal delivery. If not, you might have to have a cesarean. Any previa that is disrupting the flow of the cervix usually will end up with a cesarean as well, just because that is kind of a higher risk of hemorrhage as the baby's coming down. For me, actually, both of my kids were placenta previa up until week 30. And then actually the placenta went back up. So I was really nervous about that, but it ended up kind of actually situating itself. So it worked out for us. And then for beta strep is so common. I mean, I would say I would get on one shift, maybe half of my patients are GBS positive. The biggest thing with that is that normally we would discharge people the second day after their delivery in the morning. It's just sometimes with GBS, we would want to observe them for the full 48 hours. Or if the GBS was positive and there was not enough treatment, they might have to do extra blood work on the baby as well. So that's just different things to think about. So very good complications. With vasa previa, the big thing with that is look out for bleeding. So look out if you are contracting, you're having a lot of abdominal pain, you're having a lot of bleeding, you definitely want to call your doctor. With beta strep that you were talking about before also, definitely note if you are going into labor. If your water breaks, you want to get to the hospital as soon as possible. Because if your water breaks and it's too much time between your water breaking and your delivery, the baby has a much higher risk of infection. Think about your water like a protective barrier against microorganisms. So as soon as the water breaks, that baby doesn't have that amazing barrier like they did before. So that's the big thing to look out for. As for what week should the placenta go up, it normally, I mean, it's different, but it does usually go up. It is common for it to go up and even the baby turn around the third trimester or even late into the second trimester. But those are just different things to think about. If you have placenta previa, definitely look out for bleeding. If you were to have bleeding, definitely talk to your doctor about that. And then that was pretty much our little section on pregnancy. So for the second half, I want to go into labor and delivery. That's everybody's favorite part anyways. I know that everybody wants to talk about how they want to deliver. Yes, of course. So I love answering questions. That's actually the biggest reason why I do this live instead of just kind of recording myself and having you guys listen, which I do have the recording as well, kind of going over parts of this, but I love being able to specifically speak to what you guys need as a whole, just because everybody's needs are different and there's no way that you can just watch a video and know everything there is and feel complete peace about everything, you know? So to start out, who can tell me the difference between false labor and true labor? I know as you are heading towards your delivery date, a lot of you guys are probably super excited about having this baby, and any small contraction or tightening of your belly, you're like, oh my goodness, it's time to have the baby. How would you know if this is true labor or if it's just Braxton Hicks? And this is something that's very important that pretty much every pregnant woman would definitely want to know or want to learn. Time between contractions. So that is very good. Routine contractions with a certain amount of time in between. Yes, so you guys are right on the money then. So it's all about the frequency of the contractions. False contractions, for one, they are very irregular. False labor is not regular. Braxton Hicks are just contractions. True labor, yes, I love what you're saying there is more severe. Braxton Hicks, you normally can still talk through them. You put your feet up, you drink some water, you rest, and they go away. Real labor is regular, it's intense, and you normally cannot talk through them. Your water can break and might not. Some people, you look in the movies and it's like their water breaks and then they say, oh, I'm in labor. Some people, their labor progresses quite a lot before their water breaks. Some people, their water doesn't even break until the baby is born, actually. So those are certain things to think about. So false labor, think irregular labor, it goes away. It normally, once you start drinking water, you start resting, it normally goes away. True labor is also accompanied by, like you were talking about, the mucus plug breaking, water breaking, bloody show, and even lightning. Lightning, basically, it's the baby moving down, and then you feel this intense lightning kind of coming from your pelvis area and down. That pressure just pretty much means the baby is moving in the right direction and possibly can start moving down. Nesting, which honestly, I think I started nesting in the beginning of my pregnancy. But your nesting will definitely get more intense as you move further along in your pregnancy. And as you are starting to get ready for labor, your body normally starts knowing that, and you'll start organizing things. I distinctly remember going through the nursery and organizing even like onesies according to size, pajamas according to size and age groups, and then like dividing things in different drawers. That is nesting. Nesting is where you just want to get ready for the baby. Everything has to be perfect. That is nesting. Sorry for the little cough. definitely regular intense contractions. So the next point is the hospital bag checklist. Now, this is very important to know what to bring in your hospital bag and what you do not need to bring in the hospital bag. So as a nurse, I have a few things that are kind of you might not even really know about, but as a nurse, I'm like, it would really help if somebody had these. Number one, that a lot of people don't realize are documents, your prenatal records, your license, your insurance cards, even your credit cards, cash, things like that. Your prenatal records are very important simply because if the hospital does not have your records, there is a possibility that you and your child might have to have unnecessary treatments and unnecessary procedures. Now, I never want to have a new baby brought into this world and have unnecessary treatments and unnecessary exams that are obviously not needed. So if we do not have the prenatal records, sometimes it kind of delays a lot of things. For one, when you come in, if we do not have the prenatal history, they might have to do extra labs on you. They might have to do another CBC, HIV, hepatitis B. And sometimes, even though they do those, it does not necessarily mean that they will have those results. So then when the baby's born, if it's something that's unknown, of course, they might have to do some extra treatments for the baby to make up for the facts that they don't know. So for example, HIV, if we don't know the history, sometimes the baby will have a bath. And for us, especially, we like to delay baths as much as we can. But let's say we don't know hepatitis B, we don't have HIV, the baby might have to be bathed a little bit sooner to make sure that obviously that everything's safe. Or if you don't know your GBS, sometimes we might have to do unnecessary infection screenings, which we definitely don't want. One thing that I want to avoid, not only as a nurse, but as a mom, is extra labs. So that's one thing that a lot of people don't realize is try to have a copy of your prenatal records. Even if your doctor says that they will provide it to the hospital, I will say that a lot of times doctors say, oh yeah, we're gonna bring the prenatal records, and the prenatal records never come. So I would say just be diligent about that when you go to your OB's visits. Try to ask them for a copy, especially after they get labs done. And a lot of doctors actually even have, like on your phone, you can even have the copies. And as long as we have something that we can see in the meantime what your records are, that will really help. Another thing is actually cash cards, things like that. So after you have a baby, you are going to be ravenous, pretty much, very hungry. Whether or not you're breastfeeding, your body is going to want to eat and want to eat frequently. So what you're going to want to do with that is think about the policy of the hospital for how often they bring food. So let's say they might bring food at, let's say 7, and then they might bring it around 12 and then 5, but you're going to be hungry pretty later. Baby clothes for babies born in the winter with pretty bad weather. So as for clothes, you pretty much want to have one extra layer than what you're comfortable with. The hospital normally provides clothes and blankets, but you can always bring your own as well. The biggest thing that I would say with the blankets is make sure that they are safe blankets, that they're not those big fuzzy blankets. A few reasons. One is that fuzzy blankets are very difficult to breathe through because fuzzy blankets, they just kind of trap the carbon dioxide, they overheat the baby, and babies have a very hard time breathing with those big, cute, fuzzy blankets. Thin blankets, much better, less chance of overheating. And usually without those fuzzies, it also doesn't irritate the skin as much. I'm sure you've all heard about newborn rash and how sensitive newborn skin is. So one thing that can really help with that is not having those big fuzzy clothes and big fuzzy blankets, because you don't want to overheat your baby. Overheating your baby is pretty much just as bad as having them too cold and bare chested. So you want to have them just right. Usually what I'll say is about 2 layers for the first 24 hours is comfortable. Let's say 2 blankets, especially if you're doing skin to skin. One thing that I see is some of my patients, they'll do skin to skin and then they will, let's say, go to the bathroom and leave the baby kind of naked with just the diaper inside the crib. I get they want to leave the baby in the crib. They don't want to leave the baby in the bed, but they're leaving a newborn baby bare-chested in the crib, and it does not take long for that baby to get cold. So even if you're doing skin to skin, which is fantastic, you can do skin to skin the entire time while you're in the hospital. But make sure that if the baby's not skin to skin with you, and by the way, skin to skin means nothing in between you and the baby. Sometimes the baby's wrapped in a blanket and mom's like, oh yeah, I'm doing skin to skin. I'm like, well, we have to open the blanket to be skin to skin because mom's skin is way warmer than a blanket. But when you're done with skin to skin, make sure that you're wrapping the baby in the crib. Don't just leave that baby bare chested, because the baby's going to lose all that heat from the chest and all that heat from the head as well. So just keep that in mind when it comes to dressing your baby up. Now, some other things to bring to the hospital that you might not realize as well. For moms, actually, one thing that really helps out is an extra large charger. Anytime, Renata, I am here to help. So one thing that really helps is an extra large charger as well. One thing that you might not realize is that it's kind of hard to get out of bed when you are in labor and connected to all these lines. Of course, you know, sometimes you're in labor and you're walking around, but let's say you have an epidural. They do have walking epidurals, but the majority of people do have to have a catheter and they're on bed rest until the baby is born. And it can be a little difficult to get up to go to your phone or get up and charge your phone. So an extra large charger works very well, because then you can get to the plug that's usually behind the bed, and then you don't have to do one of these numbers. So at least an extra large charger, you'll be able to comfortably do those tweets and do those Facebook messages. I'm in labor, baby's coming, you know, without having to do this as you are contracting. So that's one other thing that really helps. So for mom, you also want to think about comfy clothes, comfy robes, comfy slippers, specifics for a scheduled C-section. And I actually on the slide 13 on the PowerPoint actually has my hospital bag checklist that has exactly everything that you would want. And I even have a post about it on mommydidyouknow.com that's called Hospital Bag Checklist. And I even, I'm not sure if all of you guys have seen, but I even have a store. And on the store, I actually have this section under specials that specifically says hospital bag essentials. And those are different things that you can bring. I even have like a fan on there. I have essential oils that you can even rub during labor. I have like small bags that you can put your makeup or, you know, your hygiene supplies and all those different things. Keep in mind, the hospital does provide essentials, especially because some people, they don't know they're going to deliver, you know, and then all of a sudden their baby comes, they're like, whoa, how, you know, what am I supposed to do? I don't have anything. They provide the blankets, they'll provide shirts, although the shirts are not that great. We do have gowns as well. One thing to think about though, is especially for a C-section, is that you want to get out of bed as soon as possible. And you want to get out of that I'm a patient mentality. The best way to get rid of that I'm a patient mentality is to change your clothes. So I know that they might have gowns in the hospital for you, but as a section, the big thing that you would want to have is comfortable clothes that you might not mind bleeding on. So just keep that in mind, because you will still bleed after a cesarean birth, sometimes even more than a vaginal delivery. So just keep that in mind. Comfy clothes that you don't mind getting dirty. And you can use your own underwear if you wanted. They do provide underwear. They do provide pads. They will provide you with socks, but you can have, you know, fuzzy socks, fuzzy slippers, you know, anything like that that you really wanted. That's completely up to you. Yes, it is beautiful, but it is a process, you know, and after a C-section, make sure you're getting up. And size clothes to wear after birth, it's different, but I like maxi dresses just because they're very stretchy. And I'll normally have I don't like stuff that's too tight. I like things that breathe. So for me, I like medium or large, depending on the clothes. So you can pretty much depend on you as a person. Me, I like medium large. I like maxi dresses. I like maxi skirts, especially after delivery. And another thing is for nursing. Usually maxi dresses, they do have nursing dresses that you kind of just flip off to the side and you can be able to nurse the baby. Some people do like those robes because the robes, you can just untie it, quickly put on the baby. The robes are way better than gowns. So just keep that in mind as well. And then your support person can also help you out as well. Your support person can be there with entertainment. I've actually seen people with an Amazon Fire Stick and they put it into the TV of the hospital. And I'm like, that is genius. So Amazon Fire Stick might work very well. Keep in mind, normally the Wi-Fi's in the hospitals are not very good. So sometimes you might be wanting to stream something. It might take a little while. Or I know that things like Disney Plus, they actually have that you can upload in advance so that at least it's already there. So, you can always upload videos in advance so that you can have it. And then some hospitals even have, like my hospital actually has videos as you're in the hospital that's on the TV that goes over like newborn care and things like that. So those are just a few things to pack and think about. Another thing that I wanted to go over as well, especially now as we're going through this whole COVID crisis, is some things to expect in regards to COVID in the hospital. One thing to keep in mind is that things are always changing. Like even I'm sure between when I last worked and tomorrow when I go back to work, that things are probably still changing again. Currently, with most hospitals, they allow one visitor to be with the mom from labor onto discharge. That person usually cannot leave. It is better to call the hospital though in advance just to confirm with them what their policy is. But normally it's one person that normally has something called the printed band, which is a numerical band that matches mom and the baby. So that's just something to look into. What is your hospital's policy? And then what happens if you were positive COVID? So for us, if a mom is positive, the dad can stay with the mom or the support person can stay with the mom up until the baby's delivery. After the baby is born, the dad has to leave or support person has to leave. And then the main reason is because the baby has to be discharged with a healthy parent that does not have COVID. So that's the biggest thing we're looking for is obviously if mom, dad, and baby are hanging out in the same room for the whole time, and then it would be difficult for us to find a healthy parent to take home our healthy child. So if you were to think about going into labor and you were to be COVID positive, don't be afraid of mentioning it to your nurses. It's important that we, start making precautions as soon as possible. And that's pretty much what to expect. As for food, right now we're allowing people to bring food to the hospital, and then you or your support person can meet them at the lobby, at the entrance, as long as you or your support person does not leave the hospital and your family members do not enter the hospital, but they can bring clothes and food, especially, like I said, moms are ravenous, and normally hospital food sometimes does not exactly fill moms up completely, or let's say you're hungry at 9 o'clock at night. So those are just certain things to think about. Do people have other questions in regards to what to expect with COVID planning? And we do allow moms to pump and provide that expressed milk to babies. Current research has shown that actually, although the COVID antibodies do not go in the breast milk, it does show that breast milk does protect a lot of the comorbidities that come with COVID, such as respiratory distress and respiratory infections. So if you were to be COVID positive and your choice is to breastfeed, I would highly, highly recommend that you try pumping and expressing that milk to the baby. If your hospital does allow direct breastfeeding, or if it is your choice to still do direct breastfeeding, make sure that if you were COVID positive, that you're wearing a mask, that you're washing your hands, and that if you are very symptomatic, coughing and things like that, you try to avoid that, especially if you are asymptomatic. if you are symptomatic. So the next thing is about what to expect when you get to the hospital when you're in labor. So first off, they'll obviously look at your prenatal records, they'll have you sign some papers, and then they'll be doing vaginal exams. Now, with a vaginal exam, they're looking at the dilation, which is how open the cervix is. And it's important to know the vocabulary, just because sometimes people are getting these checks all the time and they don't really know what they mean, or the doctor's saying something about their cervical exam and they have no clue what it's actually saying. So number one is dilation. How open is the cervix? Obviously, it's between 0 and 10. Once you're around 7, that's considered transitional, baby's coming soon. When you're at around 3 to 4, that's considered active labor. You can actually be sitting at like 1 to 2 for a long time. Actually, with both of my kids, when I got into the 3rd trimester, I already started getting about 1 centimeter dilated. So just because you're dilated does not necessarily mean that you're in active labor. The next one is ripeness, is how soft the cervix is. The cervix needs to be soft in order for dilation to occur. If the cervix is not soft, and then they might have to dilate you manually, will soften the cervix manually with a cervical ripener is what they call, which is usually it's called Cervidil is what they use, which is a cervical ripener. If you were to be induced and they have to do the cervical ripening first, you'll normally be admitted in the evening. And then is there any technique to speed up dilation? Obviously, walking, water, and resting, actually relaxing, because your cervix cannot dilate when you are very stressed out. So that's one thing to really keep in mind, is try to be as zen as possible. And that's the biggest thing. And then the walking really helps as well. If your contractions have obviously started and you're trying to speed up the process, walking really helps. Drinking water helps too. Although water stops not real contractions, like if you have false labor, water will stop it. But if you have true labor, you want to stay hydrated as much as possible, especially. You can do Kegel exercises. Some people do Kegel exercises, which are pretty much when you tense in. It's pelvic floor exercises, are basically Kegel exercises. So some people do those. Some people even do nipple stimulation. There's not enough research to really be pro or con nipple stimulation, but one thing that we do know is that people want to avoid it if your baby is not term. So let's say you're 36 weeks, you do not want to try nipple stimulation as a labor progressant, because it can actually bring on preterm labor, rather than, let's say you're 39 weeks pregnant and your labor has started, you have a healthy baby, you have a healthy pregnancy, you can walk, you can do Kegels, you can do those nipple stimulation, and even intercourse as well does help with getting that labor started. Because like I said, the more zen you are, the more calm you are, usually the better. Yes, of course. And like I said, I love answering questions. The more calm you are, the better your labor will go. And also you want to stay calm because you want to help with the oxygenation to the baby, because the baby first and foremost is very important when you're going through labor. So we talked about dilation, it's how open the cervix is, ripeness, how soft. Effacement is how thin the cervix is. So you want it to be 100% effaced thin. It's the more thinner it is and the softer it is, the faster you're going to be dilated. Then the next thing they're probably going to be talking about is station. Station is the position of the baby in pluses and minuses. If your baby's engaged in the pelvis, it is a 0. If your baby still is in the negative numbers, it still has a while to go. So let's say let's say the doctor checks you. They say, okay, the baby's at -1 station. That means that the baby has not yet engaged in the pelvis, that you probably still have a little bit more to go. 0 means the baby has engaged in the pelvis, and let's say +1, +2 means that the baby has already passed the pelvis and is starting its descent downwards. So those are different things that you can hear when you are listening to these exams. Then you have the position of the baby. Is the position head first or feet first? Perhaps it's shoulder first. Those are all different things to think about. The position of the baby tells a lot about how your labor and delivery will progress. If your baby's feet first, like I mentioned before, you might have to have a cesarean birth. And in the end, of course, it's all the health of mom, safety of baby as well. So we'll just go with the flow. I know sometimes people have a specific view in their head about how their labor and delivery will go, or how their childbirth, how their pregnancy would go. But in the end, just be patient, try to be as flexible as you can, and just go with the flow. If in the end, if you have a healthy pregnancy, healthy baby, healthy mommy, that in the end is what you wanted. I know that some people, C-section is the last thing that they want. But, in the end, if that's what's going to save you, save the baby, in the end, that's what we want. And then we have the position of the cervix. The cervix moves from posterior to anterior as you progress through your labor. So now here is a question for you guys. If, let's say I am your OB and I am checking you and I am saying, okay, you are 6 centimeters dilated, 100% effaced, and your baby is at +1 station head first. Would you say that you still have a long way to go in your pregnancy, or would you say that in your delivery, or would you say that your delivery is coming pretty soon? So let's say you're 6 to 7 dilated, your baby's at +1 station, you're 100% effaced. Would you say that your birth will probably come pretty soon? Would you say that you're in active labor, or will you say that you're still pretty early? This is a test to see how much you guys have learned about vaginal exams, which is important because, yes, coming soon, exactly. Because if I know that we're so easy, just kind of, yes, exactly. Tatiana, Renata, you got it. The baby is coming soon. So let's say, so many times the doctor's like, all right, we're just coming to check you, and you'll just open your legs and just, that's it. But you need to be active in your care. You need to be active. It could be hours, yes. However, that does mean that you are in active labor. It can be a while, yes, but at least it's coming soon. They probably will not discharge you like that. The biggest thing, of course, is that if your baby is at +1, that means that the baby's actually coming down. Usually once they pass that pelvic canal, it's usually, once they're past that engagement in the pelvis, it's usually very, very quickly. And then sometimes your labor can last a long time, and then sometimes it can be very, very quick. With my first, I was in labor for 18 hours. And then with my second, I was in labor, I think it was like I was in the hospital for 5 hours. And then I ended up delivering my baby. In fact, I didn't even realize that the baby was out because we were doing practice pushes. I pushed once, and then I'm getting ready to push again. And then he pulls up the baby. And he's like, oh, look, here's your baby. I'm like, oh, that was it. But that was my second baby. With my first took 18 hours and of the labor, and then the pushing took forever. But I think that the kids are like that too. My first is very connected to mommy. He loves his mommy. My second, he loves to be on his own. He loves to learn about the world. So I guess sometimes it depends on the babies as well. So when you're going through your labor, there's different stages. Stage 1 is early labor to full dilation. Stage 2 is pushing. Stage 3 is the placenta. And stage 4 is the golden hour. So can somebody tell me one very, 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 very important thing that you want to happen in the golden hour? We have quite a few things, but there's one very important thing that you want to do with your baby in the first hour of life. Now, I'll give you guys a minute to think about it. Skin to skin, exactly. Thank you so much, Tatiana, Jacqueline, you guys are correct. Skin to skin. So in the first hour of life, whether you're breastfeeding or bottle feeding, you want to do skin to skin. Now that helps with a few things. It helps mom regulate her body after delivery, for one, and it also helps the baby. Helps the baby to breastfeed if that's your choice. It helps the baby to regulate the temperature, those sugars, and it even helps the baby transition to life outside the uterus. And breastfeed, exactly. If breastfeeding is your choice, you want to feed the baby within the first hour. The one big reason is because babies are also very, very active in that first hour after delivery. So that first hour is so important to start getting that breastfeeding working. Actually, studies even show the faster that women initiate their breastfeeding session, the more successful they are with their milk production and the length of time that they end up breastfeeding their baby. So that's definitely some things that you want to do, skin to skin and breastfeed if that is your choice. Now, some tips to progress your labor. We mentioned a few before. Keep calm. We mentioned to walk around as well. Another thing that I also want to talk about is manage your breathing, which is very important. I know we only have a few minutes left. I'll be considerate of your time, but definitely manage your breathing. One thing that a lot of people don't realize is that breathing techniques for pain management are not only for mom, but they're also for baby. The reason is because when you are actually effectively breathing, you are effectively oxygenating your baby. So if you are in labor and your pain is just not working and you're in a lot of pain and you're screaming, the more you scream, the more you use up your energy, the less oxygen is going to your baby. Therefore, the less oxygen is going to your baby, sometimes the heart rate goes down, and then that's when we get to those emergency situations because we want to make sure that we are oxygenating our baby. So make sure breathing well, try to maintain that pain as possible. Non-medicinal pain relief is perfectly fine. You can always use Lamaze. You could use aromatherapy on my website. Like I said, I do have those hospital bag essentials. I have aromatherapy on there. I even have, because usually you cannot burn stuff in the hospital. Some birthing centers, they might have it, but they have essential. I do have like roll-on essential oils that you can actually smell that have different scents. Some people even put them in cloths with the essential oils, and those work very well. Massage, counter pressure works amazing, especially what you do is you'll have your support person apply counter pressure to your back where your sacral area is, and that really does help. Then also there's IV pain medication. If you don't want to get the epidural, it's just IV pain medications, normally fast acting, but sometimes it gets you loopy. So that's one thing to think about. Epidurals are sometimes people might use them for vaginal deliveries. They are just very local. You probably, after your delivery, it'll last about 2 to 3 hours and you'll be able to start walking again. Then if you have a cesarean, you'll have a spinal, which lasts a little bit longer. Sometimes it'll take about 6 to 8 hours. So those are just different things to think about with that. Now, I just want to review a little bit. We have a few minutes left. So I want to talk about just a few different things about pregnancy and labor and delivery, and then we'll be able to close. First off, I just want to thank all of you guys for being here. This was a great hour. I know that there's so much to think about. And I will be doing my giveaway in the end of our review. The way that you will enter the giveaway is by participating in the review as we do it. So it's actually a fun way that we all can participate and then learn, obviously, at the same time. And then my store, actually right now I am having this promotion that if you spend $75 or more, you actually get 2 free gifts. And the free gifts actually also include my prenatal classes that are online and 2 weeks long. So if you purchase something, you can actually have a premium 2-hour class as well. And then I also have like nursing covers. I have some baby clothes on there. I even have maternity dresses, nursing dresses, and even some just pretty ladies dresses that are pretty nice as well. So let's begin with our review. So for number 1, we're just going to talk about pregnancy first. So what are some common prenatal tests that you might expect? And there's, no right or wrong answer. I just want to see who has been listening. So you guys can participate by just saying some of the prenatal tests that we talked about earlier. And yes, I do have a breastfeeding class and I do have consultations as well. So if you go on my website, I have free classes as well that are 5 days long. That's a breastfeeding. And I also have another one that's a prenatal class as well. So at least I have plenty of resources on there. And then the premium's 2 weeks long. It literally in the end of that breastfeeding premium class, you can probably be a lactation consultant yourself. It's a very, very long, it's a very nice. So yes, exactly. Nuchal translucency, rubella with a B, a glucose screening, exactly. HIV, glucose, yes, exactly, rubella. So these are perfect. So glucose screening test, rubella, we did talk about the AFP, hepatitis. Yeah, you guys are fantastic. You guys are listening. Man, you guys are amazing. Exactly, hepatitis, and we have the HIV. We also have the GBS that we talked about earlier. Another one is, what are some complications of preeclampsia? So preeclampsia is high blood pressure. So what are some things that you might have to look in for the baby if your blood pressure was to be too high? Then, of course, with preeclampsia, you would want to look out for your headaches, blurred vision, things like that. But what are some side effects for preeclampsia? So stomach pain, yes, but what about for the baby? So let's say complications of preeclampsia. Would you think that you would probably, if your blood pressure is very high, would you think that you would be carrying to full term, let's say 39, 40 weeks, if you have, exactly, Jacqueline's on the money, early delivery. So with preeclampsia, one big thing is preterm delivery, just because if your blood pressure runs too high, they might have to take the baby out in order to prevent that blood pressure from going higher. So that's a big one. Early delivery and also small babies. I'm not sure if I mentioned that or not, but small babies is a big one. And then what about for gestational diabetes? We talked about that a little bit, but let's say you have gestational diabetes. What is one big thing you have to look out for your baby? So it does have to think about the placenta. If you have gestational diabetes, something about the placenta that was feeding the baby before, that after the baby is born, that placenta is not delivering as much. Therefore, the baby might have low what? And don't worry if you don't have exactly the correct answer. But think about gestational diabetes is obviously sometimes they might need diet, hypoglycemia, and you even use the medical word. That's fantastic. Exactly. Hypoglycemia. So that's the big thing you're looking out for is low blood sugar in a baby. Now for labor and delivery, what is the difference between false labor and true labor? So we did mention quite a few differences before, but it does have to deal with the time between contractions. We talked about time, we talked about frequency. So how would you tell the difference between contractions? Exactly, Renata, you're right. So true labor is regular. Normally your Braxton Hicks go away with some water and rest. Normally, true labor, you get regular contractions. You'll probably even lose your mucus plug. You might even end up breaking your water, having bloody show. Different things like that are signs of true labor. Exactly, regular contractions. You guys are perfect. Now, why would you pay attention to oxygen use during labor? So we just talked about this a few minutes ago, but why is oxygen so important? Why is your breathing so important during your labor? And it does have to deal with the baby. Yes, to relieve pain, but there's even more reasons for breathing correctly. Exactly. It impacts your baby's oxygen, which a lot of women do focus on the pain relief aspect of breathing exercises. But breathing exercises are not just for moms. Breathing exercises are also for the baby. So you can also lay down on your left side. They'll sometimes even give you fluids. They might even give you an oxygen mask. Those are different ways that they might have to increase the oxygen levels to the baby and keep them nice and stable. So this is the last question of our review, and then we'll do our giveaway. And my question is, what is one thing that should happen during the golden hour? So we did mention that a little bit before, but it is very, very important. So in the first hour, you know, it's a big time for our little baby. There's a lot going on. Skin to skin, exactly. So skin to skin, and you would try to initiate breastfeeding if possible. If there's a separation between you and the baby, you would also try to initiate pumping as soon as possible if you did want to initiate your milk supply. So those are just different things to think about. And breastfeeding, exactly. You guys are fantastic. So this was an absolutely amazing class. This was the first half of my whole series, and just because there's so much to talk about, I divided it into 2-hour sessions instead of cramming everything into one. So for my next class, and I will be doing a giveaway in the other class as well. My next class is 2 weeks from now, and it's on the Eventbrite website as well. Let's see when it is. It's on the 14th, and we will be doing our focusing on postpartum and newborn care. So it's the second half of the series. In the meantime, I highly recommend that you check out my website, see the free class that I have on there. When you go on the website and you see Baby Academy, you'll be able to see free classes, premium classes. I even have a video library on there. And you can also subscribe to the YouTube channel. I have a bunch of different classes that I have. Prenatal classes, baby classes, breastfeeding, pretty much like everything you'll need, really. And I'm putting more videos too. So for the giveaway, I'm going to do it really simple. And of course, anybody who has been active during this class is eligible to participate. I am thinking of a number 1 through 10. Okay, so I want everybody to put down their number, and then if the number that I'm thinking of, more than one person has it, we'll just do it again. But everybody can put down a number, and then we will see. And I'll wait so that everybody can really think about their number. And then the winner of this, I will be emailing you a code, as long as I think I pretty much have everybody's information. I will be emailing you a code that will have the giveaway for the $25. And then I think that's most everybody. All right. So actually my number, I was trying to give everybody a time, but my number was 7. So Jacqueline, you have won the giveaway for today. Oh, okay. Well, I already put in the number. I already said the number though. So anyways, Jacqueline, did you signed up in the Eventbrite page, right? Because then as long as you signed up under your name, I'll be able to send you an email. Okay, perfect. So then I'll be able to send you an email with a code. I will send that to you. If you don't get it in the next 10 minutes, you can always email me and then I can send it back. And then for everybody, it was a pleasure. If we can close with just what everybody's favorite part of this class was, just so that I can know what to focus on for next time, and you know, what you enjoyed about this class, really, because I want to grow this. I really thoroughly enjoy teaching. I thoroughly enjoy this interaction and just, you know, helping people, especially now that, I mean, there's not a lot of resources out there, unfortunately, as so many classes have been canceled. So I just figured that this class would be a great help for people. So if there was something specifically that you liked about this class, or maybe something that you didn't know before that you have learned now, I would love to hear it from you guys. And then if anything, you can also email me as well if you have any questions. I do have consultations. My consultations are only $25, so you know they're very affordable. You can always email me if anything. I'll be more than happy to speak to you one-on-one. I do phone, video, whatever works for you guys. And then did we have any other questions? like any other questions about the class or anything like that. If not, we can end for now. Expect an email. I will send you guys an email with a PowerPoint again, just in case you didn't get it. So this was from the Eventbrite page. So all of you guys that registered for Eventbrite, I will be sending you another email with the PowerPoint to make sure you get it. So keep that in mind. And then if you guys have any questions, you can always email me. So I'm so happy that you all loved it, and I really hope we can stay connected, and feel free to stay connected. I'm glad that you guys found it informative, and I thoroughly enjoyed working with all of you. All right, so have a wonderful day. Stay safe. It's been really rainy for us today, but hopefully it's a little bit clearer for you guys. All right, so have a wonderful day, and I will be seeing you guys hopefully soon in another one of our future classes.